would you say is one of the most emerging, important topics facing veterans and the mental health discussion today?
That's a great question. I would say one of the things that's coming up a lot within the research community, but in the clinical community, that is really becoming very pervasive, has to do with moral injury, which is a really interesting topic that stretches across all the veteran populations in service or service eras. But this concept of moral injury, a lot of research is kind of coming out. So people describe moral injury in a number of different ways. I recently heard one description of kind of the undoing of one's soul, which is kind of a big way of describing it. I look at moral injury as what happens when a person is in looking at kind of their behavior, right? And I will say that moral injury looks at a couple of different things. It could be things that maybe a person did while they were in a war zone. It could also be what they were witness to, compelled to do, what they saw others do, what they saw maybe leadership doing, right? People that they saw as moral authorities behaving in immoral ways, or just what they saw humans do to other humans. All could be construed as moral injury. And I see this coming up in a lot of the research and clinical guidelines, and in therapy sessions quite a bit. Veterans are describing moral injury. A very simple way of describing it is looking at their behavior in Baghdad or Kandahar or the Mekong Delta and evaluating it by Salt Lake City standards or morals. So the morals of here, evaluating the behavior of over there, the things that were important to do there to stay alive, wartime behavior on the morality of here, of being in garrison.
So are you saying those are like two different sets of standards that then they are having to figure out for themselves when they come home?
Mm-hmm. Yeah, so in some cases it is. It's a different set of standards, things that you are required to do in a war zone to keep yourself alive, to keep your buddies alive, to following the orders of your leadership, watching leaders make decisions kind of in the moment, life or death decisions, very much on the moment that later you have tend to consider and think about, and you're like, wow, I wonder if that I needed to really do that. Did I mark the right building? Or I know I marked the wrong building, but it seemed like it was the right one at the time. And so after all the adrenaline comes down and you reevaluate your behavior from a different emotional state even, you start to second guess and think about it differently. And the idea that you're the hero, the good guy, you're like, well, actually I did some really terrible things. And so it creates an interesting quandary when the veteran is told, thank you for your service. And they're thinking about that time they did something that now they consider to be immoral, when they violated their own moral code. So some of the consequences that a person who is experiencing moral injury might go through is, obviously feelings of guilt or shame, right? So we often feel guilty when we feel like we've done something wrong. That's kind of our brain's natural way of saying, hey, we've acted outside of our moral compass, right? And guilt kind of gets us back kind of in line. But the problem is, when we're kind of living our normal lives and we do something like, oh, I really shouldn't have done that, I shouldn't have said that, when we're fighting with our spouse and we use a name or a word, they're like, oh, I feel bad about that, I'm not going to do that again, right? But with moral injury, it's a little bit different, because you're evaluating your behavior on an unfair standard or an inappropriate standard, right? And so you might have excessive guilt or shame. Now, shame is interesting because what shame causes one to do is hide. And so you fear telling your stories, and so you don't want to talk about your time there. You don't want to talk about what you've experienced, which is, for most veterans, really a critical part of their development as people, their time in a war zone. It's a seminal part of their lives and their own development, but they can't talk about it because of the moral injury. And so they alienate themselves from their spouse, from their children. We all have stories about our grandparents who served perhaps in World War II, or our parents in Vietnam, or where they won't talk about it. And we feel cut off. We feel like we don't know a really big part of them. And they also feel cut off from us, because if we knew, we wouldn't see them the same. They would lose that esteem, and they fear that loss of esteem, so they keep it to themselves. And again, in the back of the brain, what happens is these things fester, and they grow in darkness. And if they can be brought to light, they can be cleansed. But there's that fear, right? That loss of relationships. If people only knew, how would they look at me? And I hear veterans say all the time, if my wife really knew, I couldn't bear the way that she would look at me. I think spiritually, we are we're kind of raised in with a sense of humanity, of caretaking, right? We want to kind of protect life, and I think we are raised in a way to kind of protect life. We're taught not to hurt others. Don't beat up your brother. Don't beat up your sister. And the number one thing is not to kill, right? So we're taught thou shalt not kill if you're Judeo-Christian heritage, and all of the religions kind of teach about not killing. In our culture, in the U.S. code of our judicial system, the worst crimes involve murder. The only thing you can actually receive a capital punishment for is murder. Not even sexual assault on children doesn't lead to a death sentence. So thou shalt not kill is the number one topmost thing never to do. And then you join the military and they give you a gun and they say, kill that person. Now what happens is the spiritual component is you have to overcome all those years of training and undo that. We found that World War II, there's a very small percentage of infantry soldiers who are actually able to fire their weapon at another human being. Surprising number of people who never actually fired their weapon. They had all their rounds still with them because they could not overcome thou shalt not kill. I think the number is about 25%, right? That's a lot of people who couldn't fire that weapon. With the Vietnam era veterans, they ended up having to change how they trained to shoot with silhouettes, that you aimed at silhouettes of humans instead of at a bullseye target like in World War II. So you were at least shooting at this. So you had to kind of desensitize the person to shoot at a silhouette, right? For our era, they actually have virtual reality, where we are seeing LED screens and we're firing weapons, not with real bullets, but like kind of like a air fired, right, at insurgents, and to further this. And what we call this is kind of a moral fading, where we're desensitizing ourselves to be allowed to fire a gun at another human being, right? But there's an emotional and social cost to this. Let me tell you a quick common question that veterans hear that they detest hearing and they fear hearing. Have you killed anybody?
Oh, sure.
They go to Thanksgiving dinner and a relative is like, oh, did you kill anybody? So this is moral injury, and this is a do not do, okay? And to the person who's asking the question, what they're asking about is the climax of their favorite war movie. Because that's the cool bad guy. Yes, the bad guy gets it, the good guy wins, is the moment that the good guy kills the bad guy. So they think that they're asking about the climax of the veteran story. But they're not. They're asking about the most intimate detail of that veteran's experience. The part where they may have committed for them a grave moral injury. One of the veterans that I worked with, this is a really interesting story, I think I'll share this and not disclose his name, had very severe PTSD. And we worked through his trauma that he thought was the more significant trauma, and that was the death of his battle buddy. And we did it through a series of kind of retelling of the story until he was able to grieve the loss of his battle buddy. He was there for that. It was a bomb that had killed his friend, and he was there, and we worked through that trauma. Surprising to him and to me, his PTSD symptoms never went away. And he disclosed to me kind of quietly, well, that wasn't the worst thing, and I fear telling you the worst thing. I said, well, when you're ready, I'm happy to hear it. And the story was, it was on his first deployment, when it was a lot of hand-to-hand combat, and he found himself face-to-face with an Iraqi soldier, and he was out of ammo, and all he had left was his knife. And it was either be killed or kill this Iraqi man who also had a weapon. And he had to stab this Iraqi man and watch him die. And he was so ashamed of that. On the Iraqi man was a picture of his family. And he saw the Iraqi man's wife and daughter. And this Marine, this tattooed Marine, was just bawling in my office because of that face-to-face interaction, what we would call now a moral injury, because he was evaluating that behavior. In the moment, he knew there was no choice. But evaluating that later was really impactful. And he felt like the bigger deal should have been the loss of his friend, but the biggest deal really was the moral component of thou shalt not kill. And there he was, making that decision. So never ask a veteran, have you killed anybody? Because veterans in therapy bring that up all the time, and we have to come up with answers. And I always tell veterans to pull that person in real close and just say, well, not today.
Honestly, is there anything else that the public needs to know that would be hurtful or inappropriate to ask a veteran? You bring up a really good point. I wonder if some people just don't know what to say or what not to say.
I think things that I would say to say are, I would love to hear about your experience. Maybe let's go to lunch sometime and talk. I'd love to kind of hear if you're willing to kind of share. And be a good friend. And be open to just kind of hearing. Don't ask specific questions. Oh, tell me about this. Tell me about that. That's putting a demand on that veteran to tell you something. So don't make demands, but just be available and just say, hey, I'm here for you. And I don't even need to hear anything about it. If you just want to hang out, I'm here for you. And if you don't want to talk, don't talk. We can just go bowling. Just be a good friend. And be willing to kind of hear. And then when they do start to share and open up, let that happen in a non-judgmental way. Like, oh my gosh, I can't believe you did that. Don't show judgment. Be curious about their experience. And let them just kind of, because what might happen is you might inadvertently cause further moral injury by saying, I can't believe you did that, because they're already telling themselves, I can't believe I did that. So you don't want to reinforce that, but just allow them to kind of share and be open about their experience when they're ready to do it on their own terms, right? Leading off with, did you kill anybody? Is asking a very intimate question. You would never ask anyone intimate details about someone that you don't know very well. It's not appropriate. It's not how we do things culturally. So just be available and be a good friend.
Jeff, could you share with us your thoughts on the reintegration that veterans face when they come home?
Yeah, when they come home, reintegration is a great term because they are trying to reintegrate back into a life. Now, they have been on a trajectory that's different from what they left. With their families have been growing and developing, the society grows and develops, and the veteran with their own development have kind of gone off in a different way in a lot of cases. And so coming back can be jarring for some people. They're kind of a different person in a lot of regards. And so reintegration can be a number of different things. It can be physical, psychological, social. The skill sets are different, right? And so we want to help a veteran kind of reintegrate in a number of different ways. We want to help them find what they can do that's valuable in society, in the civilian world. When you're in the military, you're given a thing to do, right? You're given a task, you're given a job, an assignment, a mission, an operational order to get a thing done. In the civilian side, they get to make their own choices, and for some that can be overwhelming. And so we want to kind of help guide them. And so there are a lot of services available to guide veterans into, educational opportunities, and we have a lot of programs that help, with education. So there are some jobs in the military that translate very nicely into the civilian world, and that can be great. And others that they don't translate well, and they need all new training. So we want to make sure that we can find them vocation, because what can be very difficult is a loss of sense of purpose. And not having that can be very destabilizing for the vet. They're also losing, in a number of cases, their family, their military family, their brothers and sisters that they served with. And so they've lost those really tight connections, the bonds that are formed in their military service. And so helping them kind of reintegrate socially is really important, and they're going to experience loss. And we want to help ease that as much as we possibly can.
When you talk about loss, are you talking about a true grieving cycle?
It can very much look like a grieving cycle, absolutely. And I think now it's better because of how connected we are through media, social media, phones, text messaging. We are well connected, but you still lose that loss, and partly because within the military, you love the ones that you're with. Right? And so when a person leaves, you kind of band together with the people who have stayed, and you kind of just keep forming and your network. And so the person who leaves is on the outside. And we always say we're always going to stay in touch, but it's different. And that person who has left is on the outside. And they can call and make phone calls and text, but it's not the same. And so they do have to grieve that loss. And part of that grieving, the final stage of grief, is acceptance. And they have to form their new social network. And a lot of vets get really stuck and have a hard time making their new social network. Partly because with the military, you're assigned your friends. These will be your friends. And here, you have choice.
So we've talked a little bit about the psychological reintegration that needs to happen, even the social reintegration that needs to happen. Could you share with us what your thoughts are on the physical reintegration that needs to happen?
Yeah, so physically, like, the military service can take its toll on the body. All the running and jumping out of airplanes and all these things that we do in the military takes its toll. And so veterans need to be able to get access to good health care. We know that their knees, their hips, shoulders, a lot of things, back problems are kind of ubiquitous within the veteran population. So we want to make sure that part of reintegration is getting health care. And a lot of veterans are really reluctant to do that. They may view the VA in a stigmatized way, like this is the government. They don't want to go to government health care because of a stigma that they see about the VA. And a stigma that in some cases is well earned and well deserved. The VA has done a lot of reformation in the last years to fix a lot of the problems, and I always encourage vets to go and give them a chance and at least try. But veterans are going to be reluctant because within the military culture, you kind of suck it up and you drive on, and you don't go to sick call and you don't take care of these things until the problem is so big that you have no choice but to go get help. Right? So within the veteran community, that attitude can still be pervasive. And so we want to make sure veterans are getting health care before the problem gets so big that they have no choice. It's always easier to fix problems when they're smaller. So as a community, it's good to encourage, hey, you're kind of walking with a limp. Do you need to go talk to somebody about this? Encouraging vets to make sure they're getting their health care needs taken care of. The VA is looking at a lot of different things apart from just traditional medicine. So they are relying a lot more on physical therapy and holistic medication. A lot of studies are being done on ketamine treatments. They're even doing studies on mushrooms and cannabis use for different disorders. A lot of places are using acupuncture. So a lot of alternative medicines are being researched for use with veterans. So if you think they're just going to go in there and hack away at you with old school medications and either drug you into oblivion or hack away at your limbs through surgery, please go talk to your docs, because a lot of research is being looked into with alternative medicines and other ways of kind of dealing with problems. Alpha stim is a big thing that's being kind of introduced as well. So
what is that?
I'm no expert on this particular treatment, but it stimulates a different wavelengths in your brain that can it stimulates sleep cycles that actually encourage tissue repair in the body, as well as improve mental health. So we're looking at a whole bunch of different things that are being used with treatment. So chronic pain is a common problem within the veteran community, and we're looking at chronic pain even in different ways, looking at more holistic approaches to treating chronic pain, and bringing in within the chronic pain clinics all sorts of different practitioners, not just drugging you into oblivion, but looking at way more integrative practices for managing chronic pain. The veteran kind of coming back into their family can often be a bit disruptive, because again, having gone down a different life trajectories, they kind of come back into a family system that has sort of remained often the same, right? So the family has sort of been how they have been, and the veteran kind of comes in as kind of now an other, right? And can sort of shift the dynamic in certain relationships. Maybe they're more assertive than they had been before. They have a more crass or vulgar language than they used to use, or or now they have some tattoos or maybe some habits that perhaps you're not used to that person having. But they're going to come back in kind of a different way, and so within like the extended family network, it's going to look differently. And that will always have an impact on the family system. Within the family system, you can't drop a pebble into a pond and not have the ripples affect all parts of that pond, right? Within a spouse and children, though, a lot of times when a military service member leaves on a deployment, the wife or the spouse who stays home will take care of all the needs themselves, and then the veteran comes back and may not find a place in that home, and try to take back over, or have to find ways to find their role in that family. The kids may have grown and developed in different ways. The spouse who stayed home may have had to accommodate parenting in different ways while the other spouse was gone to make up for that spouse being gone. And so the returning spouse has kind of an obligation to sit tight and see how they can kind of reintegrate. And the spouse that has stayed home, their obligation is to find ways to reintegrate and reintroduce and let go of some things that they had been doing while their spouse was gone. So it's this dance really of these moving parts, these moving pieces, because things won't be the same.
Would you recommend family therapy in these situations? Yeah,
often family therapy is very beneficial. Family therapy, couples therapy can be a great tool to help bring these units kind of back into balance, back into equilibrium. And so the VA and vet centers both offer family and couples therapy.
From a community perspective, what are your thoughts on reintegration for vets?
The communities can often be very helpful. A lot of communities support. They show up like with the National Guard reserve units. When they kind of come home, they can kind of show up and offer support. I think communities with like hiring practices, so within the community, maybe hiring veterans and allowing for veterans to be kind of re-educated, retrained, and giving them kind of a sense of purpose with new jobs, and valuing their experience with what they've had, because like I said, some veterans or their military jobs don't translate very well into civilian things, but understand that they've been given a lot of leadership opportunities, right? They have a maturity that the average civilian doesn't have, right? So it's okay to put them in management roles and leadership roles. Give them some responsibility, because they haven't given responsibility in the military. So learn to appreciate what they bring into the workplace, and maybe ask them about their military experiences and find ways to creatively integrate them into a workplace environment. Community-wise as well, within schooling, we find a lot of clashing with veterans who now go back to school. The GI Bill gives veterans a great opportunity to go back to school and earn higher education degrees and training, but there's a real clash because they're older than traditional students. Veterans often skew in a more conservative way, but higher universities often are more liberal. And so there can be a clash. So I would say, again, to professors teaching, if there's a veteran in your class, help that veteran feel like their opinions matter and they feel valued, and recognize that they may not fit the traditional student model, but that their experience matters in class discussions, and reach out and help them feel more included and valued in class discussions and in the university experience.
A big concern that we see and that we hear a lot in the social media posts these days is concerning suicide.
Yeah.
Is there a correlation with the reintegration process and suicide among veterans?
So absolutely, suicide prevention and healthy reintegration they exist side by side. Healthy reintegration is suicide prevention, right? In very frank terms, we know that veterans who are able to reintegrate well and have healthy relationships as they kind of come home, have fewer incidences of suicidal behavior and die by suicide. I think the Joyner model for interpersonal understanding suicide, his two big factors here are thwarted belongingness and perceived burdensomeness. Belonging is so key, and this is the big reintegration part. Feeling like you belong in your home community, back in your family system, back in your religious or spiritual culture. If you can help that person really belong and feel like they fit in, that will help with that big key that prevents suicide. We know that thwarted belongingness is integral for people who start to develop suicidal thoughts. The second part of perceived burdensomeness, if you perceive that people are better off without you, and like I said, when people come back with physical or psychological problems, they may feel like they're a burden on their families. And so minimizing that burden and helping them get the health care and psychological care and getting them getting them retrained and with careers and moving them in a valued way helps reduce that sense that they're a burden. And that will reduce suicidal thoughts as well. So really key factors of successful reintegration are helping them feel like they belong and that they have a thing to do. People to be involved with and a thing to do really help reduce suicide quite a bit.
Jeff, what are your final thoughts for the public and for veterans on how to take care of themselves and how to protect their mental health?
My final thoughts. For veterans to really take care of themselves, I think part of it starts with loving who you are, valuing what you've done, what you've contributed to society, looking back with your service with a sense of pride, and really just valuing kind of, again, your contributions and what you have. And then also having a sense of purpose of where you're headed and finding that thing that's next. What can I contribute? What value do I add to the people around me and to the society at large? And making sure that I'm taking good care of myself. So the good practices of good self-care. I would say to reach out and utilize some of the resources that are available. The VA has come a long way in learning how to take care of people. There are a lot of resources. You can Google a lot of these resources as well. VA healthcare or mentalhealth.va.gov is full of resources for different things. If you want to just sit at home and read yourself how some of these things are, that's a great website. There's a constant push for more and better data on how to take care of veterans, and we're learning more and more each day. So the belief of where the VA was in the 60s and 70s we have transformed how we're taking care of veterans. It really is a different place. But don't be afraid to reach out and ask for help, ask for care. And for the families that are out there that are listening and watching as well, there are resources for you as well. You can also be very much involved in these things, to call the crisis lines, the hotlines. In fact, a lot of people who call the crisis lines or hotlines are family members saying, I'm worried about my vet and I want to help take care of them, and you can get resources that way as well. But it's okay to not be okay, and it's okay to ask for help. It's a sign of strength to be willing to say, I need to take a knee for a minute and get taken care of. It was actually a veteran who told me, when I was walking with a severe limp and requiring assistance to stand up and sit down, and say, Jeff, it's time that you go see a doctor. And even though I was the doctor and I didn't want to go see a doctor, it was a veteran who said, Jeff, it's time to go. And I finally went in and got myself taken care of. And I'm so glad I did. And that veteran to this day will say, I'm the guy that made sure my doctor got taken care of. And he takes great pride in that.
That's awesome.
So even doctors need to take care of themselves too. So it's okay to get care. No one expects you to do this on your own.